everybody has kind of filed in that's going to be joining us this morning. So welcome. My name is Katie and I work with the Sacramento Public Library, where books are just the beginning. And September is Healthy Aging Month, and we will be featuring programs throughout the month to help you in improving your overall well-being as you age. I'm going to be putting a link in to our website in the chat, which lists all of the Healthy Aging Month programs that'll be happening at the library. So make sure to check that out. And today we're so happy to offer you Living Well with Arthritis, presented by the Arthritis Foundation. And before we get started, I wanted to mention just a few things. So first is that if you would like to share a comment or ask a question at any point during the presentation, you can feel free to use the chat function, which is at the bottom of your screen. So you can just kind of hover down at the bottom of your screen and you'll see chat, and then you can type it in there. If you're having any audio related issues, please exit the program and re-enter. Typically, we find doing this helps to correct that issue, so give that a go. Also, if you need closed captioning, please click the live transcript button, which is also at the bottom of your screen. Today's program is going to be recorded and shared on our YouTube channel, which you can find under Sacramento Public Library, and it will be up by next week, so you can make sure to go over there and check it out or share it with somebody who might find the information useful. And finally, I'm going to be sending an email to all participants following today's program with links to any resources that are mentioned, along with the schedule of events that are happening for Healthy Aging Month. So keep an eye out for that email. So let's go ahead and get started. With us today is Grace Shear, Associate Director at the Arthritis Foundation. Thank you so much for being with us today, Grace, and providing this helpful information. So please go ahead and take it away.
Thank you so much, Katie. Hi, everybody. My name is Grace. As Katie mentioned, I am an Associate Director here at the Arthritis Foundation in Northern California. I haven't started my video because my computer is running a little slow today. I think it's having a case of the Fridays. So I'm going to go ahead and start to share my screen so that you can see my presentation. Can everybody see my screen with the presentation up?
Grace, I cannot see the screen, so if you want to begin.
Okay, 1 second. Oh,
No
I didn't click share. That's why. All right, so let's make sure this works. Can you see the PowerPoint now without the notes?
There it is. It's perfect.
Perfect. Okay, there we go. Thank you, Katie. So as I mentioned, I'm an associate director. I'm super excited to be here with you guys today. We have a small team of 3 staff to serve Northern California, and we work with lots of volunteers in many communities throughout the region to better serve patients who experience arthritis. So today, I'm going to be sharing information about arthritis, some of the signs and symptoms, some tips for managing symptoms, and how to become a part of the arthritis community. Our goal as the Arthritis Foundation is to help people with arthritis live their best life, be able to access care, and build relationships with others who might have similar experiences. And just a quick note, please remember that I am not a medical doctor. I don't have a medical degree, nor do I practice any sort of medicine. Anything presented today is for educational and informational purposes only. Any specific medical questions you might have or concerns that you might be experiencing, please definitely talk to your healthcare provider for any specific questions. So I am going to advance. So I'd love to start today by sharing the Arthritis Foundation's mission and vision. It can really be summed up kind of simply. We work each and every day to conquer arthritis. Our mission is to help guide families through their experience with arthritis, provide resources, connect patients with education, and ensure that no one is alone in their challenges. To accomplish this, we work closely with community partners, just like the Sacramento Library, the YMCA, and local institutions like UCSF, Stanford, UC Davis, healthcare providers, therapists, and most importantly, a volunteer force who helps to keep us connected with the community on every level. So just to share the immense impact of arthritis, it is, we don't really hear this often, but it's actually America's #1 cause of disability. It affects 1 in 4 Americans. And so that's 1/4 of us who will experience arthritis at some point in our lives. Arthritis can affect people of all ages, any race, and ethnic groups. And yeah, that definitely includes children. There's an immense burden on missed work days as well as lost wages and medical expenses. So we're going to start by just really talking about what arthritis is. I think, there is a very strong stereotype out there that arthritis is just kind of what you experience when you age. And that can't be further from the truth. It's much more than just wear and tear. It's very common, actually, and arthritis is not a single disease. It's an informal way of referring to joint pain or joint disease. There are more than 100 different types of arthritis and related conditions. Like I sort of mentioned a little earlier, people of all ages, all sexes, and races can and do have arthritis. And it is, like we talked about, the leading cause of disability in America. More than 50 million adults and 300,000 children have some type of arthritis. It is most common among women and occurs more frequently as people get older. Common arthritis joint symptoms include swelling, pain, stiffness, and decreased range of motion. Symptoms, these symptoms, they might come and go. They can be mild, moderate, severe. They may stay for some years, but can progress or get worse over time. Severe arthritis can result in chronic pain, the inability to do some daily activities, and make it difficult to walk or climb stairs. Arthritis can cause permanent joint changes. These changes can be visible, such as knobby finger joints, but often the damage can only be seen on X-ray. Some types of arthritis can also affect the heart, eyes, lungs, kidneys, skin, as well as the joints. So some of the symptoms that I glossed over a little bit just now, you want to really watch for potential signs such as pain, swelling, or stiffness in 1 or more joints. And then the second symptom that we don't really think about is joints, when they become inflamed, they might be red or warm to the touch. Joints that are tender or stiff, difficulty moving a joint or doing daily activities. And then any sort of symptoms that really just cause you to feel concerned. You definitely want to make an appointment with your doctor if you have joint symptoms that last 3 days or longer, or several episodes of joint symptoms within a month. So which type of healthcare provider to see when you might be experiencing some of these symptoms? If you're having joint symptoms that cause concern, an appointment with a primary care practitioner could be a really great place to start. But sometimes arthritis can be difficult to diagnose. So you go to your your primary care doctor. They might refer you to see a specialist. And the type of specialist who helps people with arthritis are called rheumatologists. Rheumatologists specialize in arthritis and diseases that involve bones, muscles, and joints. They're trained to make difficult diagnoses and to treat all types of arthritis, especially those that require complex treatment. You might be referred to see an orthopedist if you have a degenerative type of arthritis, which we'll also discuss in a little bit. So after an arthritis diagnosis, a nurse, educator, or healthcare provider who understands your arthritis can help to educate you on your medication plan and how to manage your arthritis on a day-to-day basis. These healthcare professionals can also direct you to helpful resources, such as those provided by us, the Arthritis Foundation, including information on arthritis in daily living, as well as who you might be able to reach out to in your community. So, types of arthritis that you might experience or hear about, or your doctor might explore if you're experiencing any of the symptoms. Number one is degenerative arthritis. So this includes osteoarthritis, which happens to be the most common type of arthritis. This is when the cartilage at your joints, which is a slick, cushiony surface on the ends of the bones, wears away and the bone is literally rubbing directly against another bone. So this sounds painful. It causes obviously pain. It can cause swelling and some stiffness. Over time, the joints can lose strength and pain may become more chronic. Some of the risk factors for degenerative arthritis include excessive weight. You might have a family history, your age, and perhaps previous injury. The second most common type of arthritis is inflammatory arthritis. So in a healthy immune system, it's designed to be protective and keep our bodies functioning and healthy. It generates internal inflammation to get rid of infections and prevent disease. But with inflammatory types of arthritis, just like any other inflammatory disease, the immune system doesn't work properly and mistakenly attacks the joints with uncontrolled inflammation, potentially causing your joints to erode. Inflammation can also cause damage to internal organs, eyes, other parts of the body as well. Rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and gout are common examples of inflammatory arthritis. Researchers believe that a combination of genetics and environmental factors can trigger autoimmunity. An example is smoking. It's an example of an environmental risk factor that can cause rheumatoid arthritis in people with a certain gene makeup. With autoimmune and inflammatory types of arthritis, early diagnosis and aggressive treatment is absolutely critical. The goal is to slow disease activity so that, we can help to minimize or even prevent permanent joint damage. And the great thing about early diagnosis and aggressive treatment is that remission is totally possible depending on your specific case. So remission, which can be defined as little to no disease activity, is the goal and can be achieved by using one or more medications that are known as disease-modifying anti-rheumatic drugs. Other treatment goals include reducing pain, improving function, and preventing further joint damage. The third type of arthritis is infectious arthritis. So this is when a bacterium, a virus, or fungus can enter the joint and trigger inflammation. Some examples of organisms that can infect joints are Salmonella, chlamydia, gonorrhea, hepatitis C, and in many cases, timely treatment with antibiotics may clear the joint infection, but sometimes the lasting symptoms of arthritis may become chronic. The fourth type of arthritis is metabolic arthritis. So uric acid is something that is formed as the body breaks down purines. This is a substance that's found in human cells and many foods, actually. So some people have high levels of uric acid because they just naturally produce more than what their body actually needs and can't get rid of it quickly enough. In some people, uric acid builds up and forms needle-like crystals in the joint, resulting in sudden spikes of extreme joint pain, or also what we call a gout attack. So gout can come and go in episodes, or if uric acid levels aren't reduced, the pain can become chronic, causing ongoing pain and disability. So given all the symptoms and all the different types of arthritis, these are some of the main ways to manage symptoms. Many people who have arthritis or a related disease may live in chronic pain, and pain is considered chronic when it lasts 3 to 6 months or longer, but arthritis pain can last a lifetime. It can be constant or come and go. Chronic pain, as you can imagine, can make it hard to perform daily tasks like cleaning the house, dressing, looking after kids. But there are some effective ways to manage chronic pain. So some of these tips are, first of all, definitely take your medications. Prescriptions and over-the-counter drugs that are recommended by your doctor can help control inflammation and pain. If you have any side effects that keep you from taking your medications, or if you have trouble affording the cost of your medications, absolutely speak to your doctor, and they can help you either find an alternative or help you work with your insurance company. The second important way to manage pain is to manage your weight. Excess weight can cause more pressure on the weight-bearing joints of your body and increase pain. Also, adipose tissue, which is what we commonly know as fat, sends out chemical signals that increase inflammation in your body. So being overweight is bad for your overall health, and it increases your chance for heart disease, diabetes, and even some cancers. So make sure you have a balanced diet with plenty of vegetables, fresh fruit, whole grains, lean proteins, such as beans, poultry, and fish. A good, tip is also to stay away from processed foods, red meat, and sugary drinks. Thirdly, you want as much as you can to stay active. And I know it sounds counterintuitive. If you have arthritis, you might be in chronic pain. The last thing you really think about doing is exercising, right? But actually, in addition to helping controlling weight, activities like walking, water aerobics at your gym, or yoga can help reduce joint pain and improve flexibility. It also helps to make sure that you're maintaining balance and strength. Cardiovascular exercise like biking on a stationary bike can also help keep your heart in shape. Keep in mind, if you're new to exercise, talk to your doctor or physical therapist to figure out what exercises might be best for you. With exercise, you will feel more energetic and it can help you sleep better. Lastly, to keep a positive attitude. Many people with chronic arthritis pain find that a positive attitude can significantly boost their ability to cope with pain. Definitely try not to give in to the pain. Find ways to keep your mind off of it. Do the things you enjoy, like a hobby or spending time with family and friends, to keep your spirits high. Although, pain can really get to us. If you need additional support, seek out a therapist or maybe talk to your doctor about alternative therapies. Some of these therapies might be hypnosis, meditation, breathing techniques. I've also heard of people seeking help from acupuncture, chiropractic, and try different things that might help you ease your pain and keep your mental game up. So how does the Arthritis Foundation help? The Arthritis Foundation is here to, make sure that people with arthritis are able to access the resources that they need. And we do that through our website. You would visit us at www.arthritis.org. If you're newly diagnosed, there are tons of resources on there. You can type in osteoarthritis, rheumatoid arthritis, whatever type that you're curious about learning more, and find lots of material about different types of arthritis and how to manage. We also have connect groups. So these are our form of support groups for patients. This is where you can meet peers who have arthritis and who might be going through similar experiences. They're all peer-led, so that means every leader is a volunteer who has arthritis themselves. And you can check out more about that at connectgroups.arthritis.org. And just to note, currently all of our groups are meeting virtually. So we are not meeting in person right now because of the pandemic. We want to keep our population safe and healthy. But what this does is it opens up the opportunity for you. If you go to that Connect Group website, you'll see that there are groups based in nearly every state across the country. And in California, I think there are more than 5 or 6 different groups. And so you don't have to be tied down to a certain location. You can look for a topic coming up that might be interesting to you, and join it at a time that works for you and meet others. Another way that we help is through patient education webinars. So in this year, we started a quarterly webinar series for arthritis patients. We have 2 more coming up. So the next one is September 18th. This is with Dr. Sarah Patterson from UCSF. She's a rheumatologist, and she'll be talking to us about integrative medicine. On October 16th, we have Dr. Neha Shah. She's from Stanford, and who will also be speaking on integrative medicine. So it'll be interesting to see the 2 experts' different takes on maybe some alternative therapies that complement, medical treatment. It also serves as a way for you to ask them questions that you might have, general questions, obviously, about arthritis or anything that they share that day. So we also work with our communities for local engagement in some other ways. I mentioned earlier that arthritis can literally affect anyone of any age. And this is our juvenile arthritis community. So every summer we host juvenile arthritis camps for the kiddos and events throughout the year for them and their families. You can imagine if you're an 8-year-old child with an inflammatory arthritis, maybe you have to take injections daily or once a week, or have a very specific diet and take oral medications. That's not really something that most typical summer camps can accommodate. So we provide JA camps, as we call it. Here in Northern California, it's called Camp Milagros, which translates to Camp Miracles. And it takes place in Livermore every summer. We have a fantastic volunteer team of pediatric rheumatologists from both Stanford and UCSF volunteer an entire 5 days with us, and local nursing students who are our counselors. So these arthritis camps are very valuable. Kids get to meet each other. It's not as common of a disease. So oftentimes a child might be literally the only person at their whole school who has juvenile arthritis. So for them to meet each other in person and spend 5 days together, it's really an opportunity for them to make lifelong friends. We also have advocacy days throughout the year, both at the state and national levels. This is where we bring volunteers with some of our advocacy staff to talk to legislators about important issues like capping the super high out-of-pocket costs for some medications. Other issues that we're working on is to reform step therapy, which, if you're familiar with it, means sometimes your doctor might prescribe a specific medication, but your insurance company may decline covering that medication because they want you to try something else before going to that. So this is called step therapy. And you can imagine it could be very burdensome on the patient because the prescription that the doctor originally wanted you to have is what they think will help your symptoms and disease. So to put the patient through more time to try a different drug, it can cause your disease to progress in that in-between time. So we're working on reforming that kind of legislation so that patients have easier access to care, easier access to treatment. And we are one of the most respected and authoritative voices for people with arthritis in the face of regulators, insurers, employers, and policymakers. So locally, we also have a couple of what we call special events. These are our community events. The first one being the Walk to Cure Arthritis. So the Walk to Cure Arthritis has been around for over 70 years at this point. And it exists in many different communities across the country. The Walk to Cure Arthritis is one of the largest gatherings for people with arthritis. We celebrate our arthritis warriors. We raise funds for research, for resources, and for a cure. So it's really much more than just a walk event. It's really bringing the community together and celebrating what our patients can accomplish. So I apologize, this says the Cleveland Walk, but we have a local walk here in Sacramento. It raises more than $50,000 and draws more than 1,000 participants every year. So hopefully next spring, we're crossing our fingers that in May, we'll meet again in person for the Sacramento Walk. Our second special event is called the Jingle Bell Run. So I'm sorry, again, it says Cleveland. This is the Sacramento Jingle Bell Run. It's a holiday 5K, and it can be a run or a walk, and it's a charitable event. So every December, we host this competitive and non-competitive event where people gather for the community. So our local event draws more than 800 participants and raises more than $50,000 so that we can continue to fund our mission. And this year, the Sacramento event at this point is slated to be in person. So if you go to our website at www.jbr.org/Sacramento, you can find out all the information there and sign up for the December event. And so I want to share with you about our new Vim app. This is an app for your phone. It works on both Android or Apple phones. And this is like having arthritis help at your fingertips. It's the latest tool in the fight against chronic pain. It's actually not just for people with arthritis. People with any sort of chronic pain are welcome to download and join the community. It helps users set small attainable goals and achieve those wins that add up to big victories and change. Vim is also a community and an information resource. And above all, it's a way to unlock chronic pain, chronic strength, and take back what chronic pain might have taken away. So just want to make sure I share that we have been working on a patient-reported outcome study. So this is where we're asking patients anonymously how pain might be interfering with their everyday lives. And this data is teaching us that almost 90% of patients have pain that interferes on a daily basis. And over 2/3 say that pain interferes with their ability to socialize with the general population. So the app is set up so it's a community of support and motivation from others who are experiencing similar challenges. It connects users within a community of users. And through the app, users can make friends who understand what they're going through and cheer them on as they accomplish their goals. So our insights data has also taught us that no two patients are exactly alike each other. Everyone will have their own health goals that they might, that empower them to improve their lives. And so the app supports anyone with those goals to set them and also to track and take control of their care. So we created this app with the guidance of this patient data and also a panel of experts who specialize in the treatment of chronic pain. We heard a lot of volunteer input and refinement from our patient leadership council. So you'll be able to download this app. You can, if you're interested in it right now, if you point your phone camera to this QR code, you can go ahead and scan it and it should bring up the App Store to where you can download the app. But otherwise, if you search your App Store for pain arthritis or arthritis Vim, it should pop up and you can download and log in. So I mentioned earlier that we have a small staff team of 3, and we rely heavily on our volunteers. We work with them hand in hand to make sure we serve patients. So if you're ever interested in volunteering with us or know someone in your life who might be looking for a volunteer opportunity, our volunteers help us by doing community outreach. We have volunteers helping with event planning. They lead our support groups. It can also be small tasks like making phone calls to newly diagnosed patients to welcome them into the foundation and hear about what they might need help with. You can also serve on our local leadership board, help us make connections with new community partnerships. And again, even small things like helping us to write thank you cards and many, many more things that you can help with depending on what you're interested in. So if you're ever interested in learning more about volunteering, please let me know. I'd be happy to chat with you more about how you might want to give back and see, what we have coming up that you could contribute to. And my contact information is here. We serve Northern California and Northern Nevada. My name is Grace Sheeter. This is my email address and phone number, and please absolutely feel free to reach out to me at any time. And I would be happy to take any questions if there are any.
And again, you are all muted, so feel free to use the chat function at the bottom of the screen to type in any questions you may have.
Perfect. Okay, well, if there aren't any questions, feel free to take note of my contact information. You're always welcome to, ask anything you think of later. But we really appreciate your time. Thank you so much. And we hope that the Arthritis Foundation can help. And I see A question from Brenda. Is there a similar entity in Arizona? Yes, we have colleagues in Arizona. Her name is Renee. And Brenda, if you're curious about connecting with her, let me know and I can help you make an introduction to Renee. Great. Any other questions? All right. Well, thank you, everyone.
Great, thank you, Grace. And if you don't mind, just stop sharing. There we go.
Yep.
Perfect. Thank you so much. Let me replace this here. Well, thank you all so much for joining us for Living Well with Arthritis. I hope you got some really great information, and what an awesome app. That's a great thing to be connected to other people who are going through the same experience so that you can get support, ask questions, and have experts right at your fingertips. I think that's a really cool thing. So thank you so much to Grace for a wonderful presentation. We really, really appreciate it. And to find out more information about our health initiatives and upcoming virtual programs that are happening at the library, just go to www.saclibrary.org. So for Grace, for myself, and for the Sacramento Public Library, thank you so much and be well. Bye.
Thank you, Katie.
Thank you.